Sublingual immunotherapy has been developed to treat patients who are in need of immunotherapy, specifically for grass and ragweed. And the tablets are formulated so it's a sublingual administration. So patients will take the tablet, place it under the tongue. The first administration needs to be occurring in the physician office because there's a potential risk of adverse events. They are being observed for 30 minutes. But the convenient part of the sublingual immunotherapy is that patients are actually then allowed to take the medications at home for the rest of the time. The goal was to provide an alternative to traditional subcutaneous immunotherapy. Many patients would like to be treated with immunotherapy but don't have the time. It's inconvenient, or they're fearful of needles, injections. So here we have an opportunity to treat patients with immunotherapy using a convenient route. Grass and ragweed are the two most common inhalant pollen allergens in the United States. House dust mite is also a very important allergen, and there is a development going on right now for a house dust mite tablet as well. It's the same formulation, so the uniqueness of these tablets is that they dissolve very quickly, so they dissolve within seconds after they are being administered to the mucosa. And the house dust mite tablet has similar formulation. But what's nice about the house dust mite tablet, it actually contains equal amounts of the two most important mites. So it will cover the mites to which patients are allergic in the United States. We have not studied the combination of house dust mite with the other tablets, but we actually are presenting at this conference a study where we did evaluate the simultaneous treatment with grass and ragweed, and we found that it was very well tolerated. We didn't see a change in the safety profile from when you actually take the tablets individually versus when we combine them. They may have local side effects. A high proportion of patients typically have oral pruritus, maybe a small swelling under the tongue. It can be a nuisance to the patient if it continues. But the good thing is that even though many patients, about 60% of the patients, do experience these side effects at the very first dose, they are actually short-lived. So typically they last maybe 15 to 30 minutes after the first tablet is being administered, and then they fade out over the next 1 or 2 weeks. But there are a few patients, typically around 6%, who feel this effect is annoying and they decide not to continue the therapy. We don't recommend treatment beyond 3 years. Guidelines recommend 3 years of treatment and then you stop. And we have a study to support that. So we did a 5-year study with grass and found that if you treat for 3 years daily, year-round, then you see a sustained treatment effect after the discontinuation. And we haven't seen any long-term safety concerns with this therapy. What is very important here is really to inform the patients well before they take the tablet what to expect. I actually grass allergic and I took one of those tablets, and even though I know quite a lot about the tablets, at the very first administration I started having this tingling and a little bit of swelling, and it made me very nervous because I was concerned it would progress into the throat, it could become severe. So I understand it's an unpleasant feeling. On the other hand, if you are being informed by the physician that this is normal, it's going to happen, and it doesn't progress in most cases, then I think patients will be much more tolerable and acceptable to this therapy. It changed from being a therapy where I wasn't really sure how effective it would be. I feel actually very comfortable with the data. I find the data very impressive. I have been involved in other anti-allergic treatments in Merck, and when I compare the data we have with these tablets to what we see with traditional antihistamines and nasal steroids, the data are actually very compelling. I'm very excited about it because, again, I think there are a number of patients who really would benefit from immunotherapy, but who doesn't get the access to it for various reasons. And now we have this treatment option. I also think that down the road there will be additional tablets being developed. So you will have a portfolio of tablets so you can actually personalize the medication or the treatments to the various allergies patients suffer from. Especially in children also, it might be a very attractive method, and it would be interesting to see whether it has any preventive effects. So there's an ongoing study right now in Europe where we're evaluating whether patients with allergic rhinitis, when they're treated, actually will see a prevention of the development of asthma. I think we always are looking for improving therapies, so I hope that we'll have more therapies coming and they are more effective. Yeah, clearly that's all what research is about. Currently this is a very, I would say, good opportunity, but we're always looking for something better.